Hi everyone, this is Emily Wengrovius and
Christina Muller.
we are your county liaisons. Thank you for joining us today for our fabulous webinar on adult protection services and what's coming up in the next few months. We're delighted to have Peggy Rogers with us and Greg Smith. I almost said Greg Scott. I'm sorry, Greg. And to talk to you a little bit more about what's coming and answer any questions that you may have. If you do have any questions, please type them into the question area and we'd be happy to address them. So without further ado, Peggy?
Hey everyone, thanks for getting on. We definitely have been trying to get the word out about the changes in APS. For those of you that don't know me, I'm Peggy Rogers and I manage the program here at the state. And I've got Greg Smith with me. He is our CSTAT manager, and so he helps me out with all the CSTAT measures for APS, both what we're doing now and what we're probably going to be adding as we move into the new data system. So I have a list of some things that I thought you guys would be interested in, just to kind of briefly talk. Feel free to ask questions and we will make sure that we address those questions as they come in. And I will try to leave time at the end for you to ask questions as well. So first of all, we're going to have some rule changes. We sent out a package of rules to all the county directors last week. It also went to all the APS staff last week as well. Those rules are scheduled to be heard at first board in May. I believe it's May 6th. That the board meeting is. So that's the first reading, and then second reading would be in June with a proposed final adoption and effective date of August 1st. The rule changes that we're proposing are fairly simple. They don't do a lot of changing as far as the program requirements itself. We are updating and simplifying the language in the rules to align with Senate Bill 13-111 that established mandatory reporting. We are also making a change to the packet that I sent to you last week to update the rules based on Senate Bill 1498, which the governor just signed about a week and a half ago. Very minor change with that. That bill only changes APS's requirement to send all reports to the district attorney. That's no longer a requirement. And then we are also aligning the rules with the new practices that the new data system will be bringing as we implement that new data system. The new data system is called CAPS for Colorado APS, and that's really kind of the big thing that's going on. The rule changes also are looking at, one of the things that we did is try to further define our quality assurance process. When we come out and do case reviews and a program review, we wanted to make sure that you had a good understanding of our process before we were to move to a corrective action. So these are all these lower level training and technical assistance that we'll do, performance improvement plan, which is a pretty low level, and then some time frames around making sure that those areas that need a little bit of improvement are improved. We are updating the rules related to supervision of casework services. We wanted to make sure that the supervisors were reviewing more cases and doing a little bit better supervision. Some of the quality reviews that we've had have not been stellar performances that we're seeing, and so we want to make sure that caseworkers are providing exceptional services to clients and not leaving clients at risk. And we're seeing quite a few clients being left at risk throughout the state. So some of this measure is to help make sure that that's not happening any longer. And then finally, we are updating the rules to require workers to attend Training Academy. For the last several years, Training Academy has been urged for counties to send their new workers to that. Now we're asking for this to be required. We have fine-tuned Training Academy so that it's we fine-tuned it down from a 6-day training to a 4-day training. And we focus specifically on the APS program and APS processes and rules so that it's a very intense week, but it gets to all the core principles and rules and requirements that your workers will need.
Hi, Peg. We just got a question. Are there plans for there to be more frequent training academies?
Yes. With Senate Bill 111, we also got additional money for training for the first time ever. It's still a tiny training budget when you compare it to like child welfare, but it's $80,000 more than we had before. So we will be providing Training Academy 3 times a year. We'll do one in the spring, and then late summer, early fall, and then again in January, kind of around that the first of the year. So with that Training Academy then, it occurs every 4 months. We are asking that everybody complete the rules within 9 months of hire or transition to the APS program. But we added a rule to allow small counties that have less than a quarter-time APS worker to have a full year to get that training under their belts, because we understand that those counties are using child welfare workers who have a very extensive and lengthy training that they have to go through before they can start working in the county. So we wanted to provide that flexibility.
Thanks so much, Peg.
So that was all that I wanted to talk about with the rules. You can certainly provide feedback on the rules yet. They're not a done deal, so if you have any comments about the rules, please feel free to send them to me. And I think we can probably get Emily to send you guys all my email address.
Yep, we'd be delighted to do that.
Okay. And then mandatory reporting and what this means to the county department. Now, with mandatory reporting came a lot of new money for adult protection for the county departments out there, and so I think there is some confusion in some counties that the mandatory reporting is going to be made to APS, and it's not. So the mandatory reporting law is actually in the criminal statute, and it's going to require that the mandated reporters make their reports to law enforcement. So they're going to be calling the law enforcement agency where that client lives or where the crime was committed. And law enforcement then will be sharing those reports with Adult Protective Services. Now, mandatory reporting is really only for people who are age 70 and older. It's a new category called at-risk elders, and it's strictly an age-based criteria for the mandatory reporting. So when law enforcement gets that, if that person is 70 or older, that's a mandatory report to law enforcement. They're going to share that back with the county department. But with the county departments, what you're going to need to do then is make sure that you are evaluating that report based on the APS criteria, which is not changing. We're still going to be looking at-risk adults, age 18 and older, and we aren't strictly based on age. There has to be some other factor going on that makes this person unable to make decisions, unable to get services in place for themselves, unable to advocate for themselves. So you may not go out on all the reports that you get from law enforcement. So it will be important that your APS staff continue to evaluate the reports so that you're not increasing your workload when there isn't a need for you to increase that workload. For example, I have a brother-in-law who's going to be 70 this year. He's no more an at-risk adult than any of us sitting around the table and talking today, but he has kind of an acerbic personality sometimes, and if someone were to haul off and hit him, that's abuse of an at-risk elder under the criminal code. But APS isn't going to get involved because he doesn't have any risk factors that require us to help intervene on his behalf. Do we have any questions?
Do we have any questions at this time? Okay. And if you have them, you can type them into the question part of the webinar or into the chat box.
So the impact to county departments with mandatory reporting, the Elder Abuse Task Force that was formed to study mandatory reporting are estimated that reports might increase by about 15%. I don't know if that's low or high. We're just going to have to see. We did see a 5% increase in reports last year already, and I think that was because there was so much media attention around mandatory reporting that people started making reports early. The other impact that you're going to have with the county department is a need to coordinate with your law enforcement agencies to make sure that they are aware that they are going to be starting to take these reports, because we have gotten information from some counties that their law enforcement agencies had no idea that this law passed or that they would be responsible for taking reports. So I think it would be important for you to reach out to your law enforcement agencies that you work with and make sure they're on board and ready to go on July 1st when this starts. All law enforcement agencies, according to the mandatory reporting law, are required to send at least one of their officers to the mandatory reporting training that was developed by the Peace Officers Standards and Training Board, or POST. So hopefully your agencies will get someone to one of those trainings. It is a half-day training. We did send Fonda from my unit to one of those, and she found it to be an excellent training. She's really excited about it. And they are training things like abuse of power of attorney and stealing through a power of attorney is a crime, and not to just slough it off as just a civil matter or a family matter. And they're also training law enforcement to stop asking our victims whether or not they want to prosecute. They're telling them, you know, we don't ask a homicide victim if they want to prosecute. We don't ask a bank if they want to prosecute if they're robbed. We shouldn't be asking grandma if she wants to prosecute if she's robbed or beaten. So counties are also going to be getting an additional $1.7 million in funding for the mandatory reporting starting in July. So that's for fiscal year 15. So total now, the total APS admin budget is just under $13 million. And then the $1 million in client services will continue to be available to the counties. We have developed a new, allocation formula that I believe has been approved by the PAC. You'll get that information through settlement accounting.
We did have a question.
Sure.
Is this a good break?
Sure.
In child welfare, there's a requirement that DHS provide information back to mandated reporters as to what the outcome of the report was, i.e. was it assigned, screened out, etc. Do you foresee there being any such requirement in APS?
Not at this time. That was not part of the law. And APS's confidentiality laws and statutes did not change, so it will continue to be non-disclosable.
Thank you.
So getting back to the admin formula, the new formula now is going to be based on demographics and caseload. So 60% is based on the demographics in your county, 40% on your caseload. That's for both the admin and the client services dollars. Something else new we did this year with the client services dollars that you can use to purchase services for clients is we've established a minimum $2,000 base. So some of the very tiny counties that don't get a whole lot of APS reports this year got as little as $50 or no dollars for client services. This year you're assured to have at least $2,000, and then if you have additional caseload to support more, you'll get the additional funds. This is going to be, in fiscal year 15, will be the last year for you to continue to shift money back and forth between APS admin and county admin in order to help true up those lines. So it's very important that your accountants and bookkeepers this coming year are working to make sure that all of your APS costs are being charged to the APS line so that your true costs for APS are being captured, so that we can make sure that we handle any changes in funding that we may need to go back to the legislature to request.
Great, Peg. Is that part of the CAP system too?
It's outside of the CAP system. The
Okay.
CAP system was additional funding that we got at the state level.
Okay.
For CAPS, yeah. Yeah, APS did really well with Senate Bill 111. We got a lot of additional new money, almost $5.5 million, was it, Greg? Yeah. Community education, it would be great for you to help train all of your community members on mandatory reporting. We have been doing a lot of outreach as much as we can here from the state level. We have developed a lot of materials that you can use. We do have an online training that's a self-directed, narrated training that you can send members of your community who might be mandatory reporters. They can take that training online. It is on our public-facing website at coloradoaging.com in the adult protection area of that website. So anyone can take that. There are quizzes that are involved, and then if it's like a hospital or a nursing facility or a home health agency that wants to make sure that all of their staff take the training, when they're done they can print out their results so that there's proof that they took the exam and passed the training. We've also developed a PowerPoint, a mandatory reporting, frequently asked questions document, a number of different newsletters that you can use, and also posters that you can put up in your community. All of these materials are available on the APS portal page, which is located on the CDHS portal where you go in to log into like CBMS and Trails. We have an APS tab, and all of the community education materials are there and can be downloaded. Or if you can't find them there on the portal or you don't have access to that particular portal, we can email those to you if you send an email and request them through our policy mailbox. And I can have Emily and Christina send that address out to you as well.
Peg, we can send it through the chat right now too.
Sure. It's CDHS APS.questions at state.co.us.
Great.
All right, so let's shift into CAPS. CAPS is probably the biggest change that's going to be happening with APS in the next couple of months. We will no longer be in CBMS as of July 1. We're very happy about that. We're all pretty excited. CAPS is a really big change. It means training for everybody. It means learning a new system. It means having people out of the office to attend that training. And it's just kind of change. And so I think it's important that you guys understand kind of what's in it for you and what's going to be good about this system for you. And, you know, first and foremost, I can say that this is going to be a much easier system for you to use. It's going to be more reliable. There is Salesforce platform that CAPS is being built on is up and available 99.99% of the time, so it's rarely down. We got a message, we're testing the system right now, and we got a message from Salesforce last week that they were going to be down for maintenance, and they had this maintenance window, and literally the maintenance window was 5 minutes. It was
used to hours and hours.
And we just got such a chuckle because CBMS can be down for a day or 2 days or an entire weekend when they're doing maintenance to the system. And so having a 5-minute maintenance window was just kind of incredible to us. It made us smile. Workers are going to be able to manage their own password resets in the system. So if they forget their password, if they lock themselves out, there's a security question like almost any website that you go on, like your bank website or a shopping website, and you forget your password, you can click on the forgot password, answer your security question, and reset your own password. That's something we can't do now. Currently, especially for small counties that may go a month or 2 or 3 between reports, CBMS will automatically take your access away from you if you're not in that system every 30 days logging in. That's not going to happen anymore with CAPS. We'll be able to run a report to identify inactive users, and what we'll do is reach out to the county before we shut off anybody's access to make sure that that person really is gone from the county. Data entry is going to be much quicker, and the system is really going to help guide the worker toward better casework. We're kind of building in smaller areas for your narrative documentation that you need to put into the system, and provides a little more guidance to them. So I think the system is going to help get us better casework because it's going to make sure that the workers aren't forgetting to do certain parts of their investigation or assessment. This system is going to have scanning ability, and so all of the documentation that you collect as evidence, bank statements, photographs, court reports if you're doing guardianship, or letters of appointment from Social Security if you're a rep payee. All of those kinds of things can be scanned and attached directly to the case. It won't be a separate area where you have to sift through a whole bunch of different cases and documents. It's going to be attached right to that client's case. So you're not going to have to worry about housing paper files and the security behind that and the file folders that you have to purchase and the filing cabinets you have to have. All of that will go away with this system. Also, if our client moves from one county to another in the middle of an investigation, your county won't have to start all over again collecting that evidence. It will be right there attached to the case, ready to go. You're not going to lose a beat, and it's going to result in better services for the client. This system can be accessed through any internet or data connection, so you can access it through any computer, through any browser, through any tablet. So I know a lot of you, especially the small counties, are getting tablets through child welfare. You'll be able to use those same tablets to access CAPS in the field. So if you're out doing an APS home visit and you just finished a child welfare home visit, you can document both right away in the system. There are a couple of large counties that are purchasing tablets for this system as well. So this is going to save time. You can be documenting in your tablet while you're talking with the client or as soon as you leave that home, so you don't have to write out notes and then go back to the office and transpose them into the system to save time. Data reports are going to be available. You can pull data on 100% of the fields in CAPS in real time in a matter of minutes. So if you have a county commissioner that has some really strange requests, like how many 50-year-olds with a traumatic brain injury did we serve last year, you're going to be able to pull that data in a matter of minutes. So this is something that we don't have right now. Our data is 40 days old at the earliest, essentially, and it's not always very accurate. This is real time up to the minute. Your supervisors will be able to write ad hoc reports. The state unit will be available to help you with ad hoc reports, and we're going to be building a number of regular data reports into the system that all you have to do is touch a button and the report will be there. We're also building into the CAPS system all of the things that we're currently collecting manually, like your AP team activities, the number of hours of ongoing education your workers have had over the past year, your contact list. All of these things are being built into CAPS so that you don't have to do manual spreadsheets and keeping track of them through that. This system is going to allow you to personalize your business days for every county. So right now the timely response, the CSTAT measure, is based on whether or not you get out to see the reports, and most of our reports are non-emergencies, and so you have 3 working days after the receipt of the report to go out. But a working day can be different in every county. Some counties aren't open on Fridays. Some counties have furlough days. Some counties take different holidays than other counties. All of those cannot be tracked right now in CBMS. We only can remove the 6 major holidays and the weekends. With this one, each supervisor in every county will be able to go in and enter their non-business days so that your calculations and your timeliness will be accurate to your county. So we plan to roll out CAPS here very shortly. We have 3 counties who have agreed to pilot test the system. We're currently testing. We're testing the intake portion and the case portion of the system. And we're not exactly sure when the pilot will start. It will be sometime mid to late May. We want to make sure that as we test and we find any little bugs and defects, we can get those fixed before we start pilot testing. Denver, Arapahoe, and La Plata are the 3 counties that have volunteered to pilot test. And so if we're able to do that, they'll start using CAPS in mid to late May or maybe early June. And then the plan is for a statewide rollout of CAPS on July 1st. So CBMS will be turned off on June 30th at 5 o'clock. You still will have access to it. It's just going to change your user profile to read only so that you can still have the historical information and the historical case information in CBMS. Your users will also be able to still get into CBMS to check whether or not the client is receiving other benefits like food or Medicaid. And then CAPS turns on and away we go.
Do you want to talk about why we didn't convert data from CBMS to CAPS? Because we get that question a lot, and it's a very good question, but there's very good reasons why we're not doing that.
So we are not going to convert data from CBMS to CAPS, and it's really for 2 key reasons. One is when we converted to CBMS back in 2004, and we had the old legacy CAPS system, the mapping wasn't done very well, and so most of the data that came over was pretty bad and pretty garbaged up, and so we have a lot of really bad data in CBMS from the rollout of CBMS way early in the use of the system. Then, for the first couple of years, we were instructed to create new client IDs, and so that's where we got all of these duplicate client IDs in CBMS. And so a lot of the data in CBMS for the APS program is not good data. We don't really want to drag that into a nice, clean new system. And then the other key reason is that the CAPS system is going to collect this information in a way that's really a case management system, very different from the way that CBMS is laid out and how CBMS functions. And so I don't know, even if we wanted to map all the fields over, I don't think we could do it. We're changing a lot of the values in the pick list fields, and the case comments is totally changing. It's completely different than the way that we currently do it in CBMS. So those are the key reasons why we're not doing that. So what's going to happen on July 1st for those cases that are still open? You have a case that's open June 30th. You need to keep it open July 1. It's not ready to be closed. You're going to have to enter that case into CAPS, but we're creating a shortcut in the system that will allow you to create a case number by just entering that client's demographic information and setting up a case number. And then you'll just document from that point forward in CAPS. The historical piece that you've been working on will remain in CBMS, and then you'll fill in the case, so to speak, as you do your home visits and monthly visits and complete your investigation and case planning. So it'll be a gradual shift. And then, of course, any new reports you get July 1 on will be 100% in CAPS.
Great. Do you all have any questions at this point? If so, please type them into the question section or go ahead and send a chat to us. So
we are trying to provide as much information as possible to everybody. We do a weekly update to all the APS staff. that we do a little bit of CAPS update, but also a lot of our training opportunities. We have set up a biweekly knowledge transfer phone call, and we send out the email as well with all the notes. We set up a CAPS group and have asked the counties to identify their key people that need to be aware of all the changes that are occurring with CAPS so that you're not missing anything and you're ready to go when CAPS rolls out. So if you have not signed up for the CAPS email group, send your information to the CDHS APS.questions mailbox and we can get you added to that group. We've also reached out to Len Meyer and Joetta Fisher, who liaison with the counties on their IT issues, and they are up to speed and they are working with the counties as well to make sure the counties are all on board and ready to go. The CAPS system is going to be limited to APS staff, so APS supervisors, caseworkers, case aides, and full-time screeners, those that work full-time business days in order to take APS and CPS reports. We are going to be training the last 2 weeks of June. We found computer labs all across the state in which to do the regional training so that counties didn't have further than 2 hours to drive to a training site. There's just one county that has to drive longer than 2 hours, and we will be providing lodging for them. Screeners, that's all they do is take reports. Their training will be a half day. For everyone else, it's a 2 full day training. After the initial rollout and we get everybody initially trained, we're going to be providing a series of webinar trainings. We're going to focus mainly on the intake and case management portions of the system. But like I said, we created an area for AP team activity and for documenting your training. And CAPS has a lot of other features as well that are going to be really fun and helpful for the worker. They can create their own charts and graphs for their dashboard, their own task lists. They can attach their calendar to the CAPS system. They can customize the look of their system and how their pages look and how their columns are laid out. So all of those things we're going to be doing by short webinars after we roll out. So we're going to get you trained on the key functions in those 2-day trainings, and then we'll start building on your knowledge of the system and how you can use it to continue to improve your efficiency through the webinars. And then new workers that come on board the APS program that will need the big training, we're going to be working on a way to do that via webinar and then hopefully via kind of some self-directed training as well.
Do you all have any questions at this point?
Okay. So ongoing CAPS support is going to be provided by my state APS team. If you have a help desk ticket, there's something not working right in CAPS, or you think a field needs to be somewhere else, or we forgot a value in a pick list that needs to be added, we are building a help desk into the CAPS system. And so you'll be able to enter your help desk ticket right there in the CAPS system. If it's an access problem and you can't get into CAPS, then you're just going to send a question to our CDHS APS.questions mailbox or call us, and we'll work on that for you. But that will make the help desk much easier. You won't be going through the county or OIT help desk for support with this. The county is going to continue to provide this desktop support for their workers and make sure they have the right browsers that will work, the right versions are updated. But other than that, all of the support is going to come through the state APS team. So we'll be managing the help desk, we'll be managing the training. We are contracting with Verteba ongoing. Verteba is the company that's building the system for us, and they will be our Tier 2 help desk. So essentially what we're going to be doing is managing those tickets that are kind of user error, or somebody just needs help with a certain area, they need some additional training, or those where we may need to add a value, those kinds of things. And then anything that has to do with the actual functioning of the system, we'll turn over to Verteba, and they'll manage that help desk ticket. And I think that's it for me.
So now we want to talk about CSTAT measures, and I'm not sure if the counties on the webinar are familiar with CSTAT, but CSTAT is a performance outcomes management process that was instituted here at the state about 2 years ago, and it basically looks at programs across the department from all the different divisions and programs that we have, and looks at the people we serve and various key outcomes for all those programs. So in relationship to APS, we've been looking at APS response timeliness to APS reports, and currently our benchmark for that is 98% timeliness of response, and we're usually running right around that. I think the most current month we're looking at, we're just under at like 97.3%, but overall, the state does a really good job, or the county people do a really good job of responding timely to all APS reports. That's a measure that we'll continue to look at as we transition to CAPS. We have talked to EMT and CSTAT about the transition to a new data system is a big change, and that there may be, you know, some bumps in the road as people learn the new system and how to document things and how to enter data into the system. So that I think they're understanding of that. But we are looking at adding additional performance outcomes to our monitoring in CSTAT, and we don't currently have the ability to do that in CVMS, but we will in CAPS. So a few of them that we've tossed around and that we're developing currently are the absence of maltreatment, a recidivism measure similar to what's in child welfare. We'll look at all the APS cases that receive services, and we will monitor them for 3 months after case closure to see if they came back into the system. So that's a measure that is currently in development. We may change the time frames. You know, in child welfare, they look at it at a longer interval. I think they look at a year for returning into the system. So as time goes on, we may modify that, but that's one of the initial measurements that we're looking at. Another one is an increase in safety, decrease in risk. And in the new data system, we'll have the ability with the risk and safety assessment tools to track the level of risk and the level of safety, and track that from beginning of case opening and services being provided to the end, and hopefully be able to see an increase in the safety of the APS client, as well as a decrease in risk. So that's a measurement that we're looking at, and that'll become more clear as the system rolls out. You'll see some of the questions related to that and how that will be measured. Another one is the screen in, screen out of referrals, quality assurance around that. Right now, statewide, there's a huge variance among the cases that are screened in and screened out. Some counties, 80% of their reports are screened in. Other counties, 90% of the reports are screened out. So we're going to look at that, and we're not exactly sure what the measurement will be at this time, but we definitely want to look at that on a statewide basis and try to learn something from that, and find out if the counties can learn something from that, and find out why there's such a variance in this the screen in, screen out across the state. So those are some of the measures we're looking at right now. I'm sure there'll be additional ones as the system rolls out and we learn the system and the counties learn the system, and find out you know, what we can look at and what would be helpful and informative and help us in our program and our practice. Is there any CSTAT questions out there?
Are there any questions in general for our team here? I want to give people a minute to type just in case. So, oh.
I think we did send out the email address that all questions can be sent to the APS team. If you think about something after we disconnect and you wish you had asked it, feel free to send it to that email address, and someone on the APS team will get back to you with a response. They can send CAPS questions to that email address as well.
Anything,
or if you send it to me and Christina, we'd be happy to forward it on to Peggy and Greg. So we are here to help answer your questions. If there's something that you're nervous about or anything like that, just let us know. We're happy to explain the changes coming and how we're here to support you during this time. So I think it sounds like a great opportunity to have a system that actually is geared towards the work that APS workers do. It's pretty exciting. It's also a big change. So we're here to support you as that change goes through. So if you all have any questions, don't hesitate to reach out to us. Thank you so much for joining us today. And we look forward to seeing you out and about in the counties. So have a great afternoon, everyone.
bye.